Hey friends, Jessica here from Northern California, and if you are new to my channel, I am here documenting my breast cancer journey. I was diagnosed with stage 3B breast cancer in November of 2022. I had a radical mastectomy of the left side where they removed 36 lymph nodes, 12 were positive. I went through chemotherapy, radiation, I had a right mastectomy, and I had an oophorectomy so that I would not have to undergo the Lupron shots. Last Thursday, so like 4 or 5 days ago, I had a routine breast MRI is what they call it. I don't have boobs, so I call it a chest MRI. But they do it with and without contrast. Had that done Thursday. I had my routine checkup with my oncologist Friday. At the time that I saw her, I let her know that I was having some tenderness kind of in the areas of like my wings. So like we still have the wings here, unfortunately, but kind of like in the back area here, more on the left side than the right, but definitely bilateral tingling and pain. The best way I can describe it is like when your hands or feet fall asleep, it's that feeling when it's touched or brushed up against. And I've been having this pain for, I don't know, like 6 to 8 weeks. I noticed it after one of my kids kind of gave me a bear hug and the pain was there. Like that's when I noticed the pain. So she did an exam and she did notice like what felt like liquid or like fluid on the outer part, kind of like back in this area here. Definitely more on the left side than on the right side, but she did feel both areas. And at the time, my MRI results hadn't come in yet, so she looked at them, but she's an oncologist. I don't blame her for not being able to read the results. So she said, like, let's just wait. Like, it's a holiday weekend, unfortunately, of course. So the results may not be in until Tuesday. So yesterday, Memorial Day weekend, I was at the park with my kids, and what comes through? Of course, the test results. And it stated that I had a bilateral seroma. So a seroma is a fluid-filled sac that usually happens after surgery. I called my sister. She is a pharmacist and her boyfriend is a ER doctor. And so like I knew she was the right person to ask about like what this was, what does it mean, how serious is it, because I was obviously freaking out. I was bawling my eyes out at the park. Like, I cannot believe that more is going on. Like, how is this possible? I know people go through recurrence all the time, but we've been like so proactive about making sure that medications are taken and tests are done. So I was like, well, fuck. So she and her boyfriend, you know, seromas are not unnormal, but they're more uncommon for how far out from my last surgery I am. I had my surgery in December of 2024 and we're at the end of May. So it's almost been 6 months. So it's not the most common thing to see. So I talked to my oncologist today. She referred me to general surgery and plastic surgery. And at this time, I had a call just a little bit ago that tomorrow morning I get to go and have the seromas aspirated under local anesthetic. You get to be awake for this, so I'm not super thrilled about that. They just numb you up with lidocaine. They guide the needle with the ultrasound. For any of you that have gone through biopsies, it sounds like it's similar to how the biopsy goes, as far as the numbing, the needle going in, and then removing the fluid. So I will have questions as far as, since I'm waiting for my next surgery, for one, like, can this help me like move up in the line since I'm still on the wait list? And then also for two, after my next surgery, am I going to need drains to hopefully not allow this to happen again? The seromas, from what I've learned online, which Google's not your best friend, they can come back over and over. They may never come back, but they're large enough on the MRI that I have to have them removed with aspirating. So I will make sure to update you guys tomorrow when I get home how that went. I'm not super thrilled. I am driving myself. They said it should be pretty, just an easy procedure. I am not too thrilled though, because I did finally get to join Pilates. About 3 weeks ago we started, and they don't want you doing any major exercise for 4 to 8 days after. So I'll just not do Pilates this week and get back on it next week. So friends, I will check in tomorrow. I hope you are all doing well. If you guys are recommended to have those MRIs or exams done, don't skip on those. I have been loyal to making sure I'm seen every 6 months for my chest MRI, breast MRI, and once a year for my PET scan. And I'm glad I didn't wait, because it could have gotten a lot worse. And that's not where we want to be. So friends, I hope you're all doing well, and I'll see you tomorrow. Bye.